Hello, we're second-year dental hygiene students from Parkland Dental Hygiene program, and we're excited to work with Illinois Grant Park Fire Department to provide information on an epidemic currently plaguing America, which is opioid substance abuse.
The focus of our video will be on the background of opioids and the effects on oral health. We believe interprofessional collaboration is vital to improving quality of care.
Today we will cover identifying the significance of opioid crisis, how to acknowledge how opioid users obtain their drugs, recognize common signs of opioid abuse. We will also demonstrate how to properly perform an oral exam and identify oral manifestations of opioid use. We will conclude by identifying sources for obtaining help with substance abuse. First, we're going to start by identifying the significance of the opioid crisis. Opioids are a broad group of pain-relieving drugs. In the brain, opioids send signals that decrease the perception of pain and boost feelings of pleasure. Opioids can be dangerous because higher doses will slow the heart rate and breathing, which can ultimately lead to death. Common prescriptions of opioids are called oxycodone, hydrocodone, codeine, and morphine. Opioid use in America has increased dramatically over recent years, and now 1 out of 4 patients who take prescription opioids become addicted. In 2012, more than 255 million prescriptions were written, which is enough to give every American adult his or her own bottle of opioids. Use of these narcotics increased, and in 2017, the United States Department of Health and Human Services declared the opioid epidemic a public health emergency. Addiction is defined as an irresistible craving for a drug, out of control and compulsive use of that drug, and continued use despite the repeated harmful consequences. Opioids are most addictive when you take them using methods different from what was prescribed, such as crushing a pill so that it can be injected or snorted.
Next, we will acknowledge how opioid users obtain their drugs. Patients can obtain opioids in a number of ways, including their dentist, physician, family and friends, or even off the streets. Within dentistry, surgical, including wisdom teeth extractions, root canals, trauma, and implant procedures generate the highest rates of opioid prescriptions. Many opioid prescriptions are not fully used by the patient, with one dental study finding that 54% of opioids went unused after oral surgery, hence how patients can obtain opioids from friends and family members. For minor to moderate pain management, health professionals are advised to consider alternative therapies such as acupuncture, mindfulness, and meditation techniques, or over-the-counter relief such as ibuprofen or Tylenol.
Oral manifestations may include dry mouth, grinding of teeth, high levels of plaque and tartar buildup, low blood pressure, and tooth decay due to a combination of sweets. Patients abusing opioids may exhibit depression, poor coping skills, and personality disorder. They may also exhibit constricted eye pupils, anorexia, depressed respiration, and decreased pain perception. Important structures to examine are the tongue, cheek, lips, teeth, and palate.
We understand that trying to locate appropriate treatment for a loved one can be a difficult process, but there are programs to help with this process, including the Substance Abuse and Mental Health Service Administration website, which shows the location of the local programs and facilities for drug addiction nationwide.
The opioid epidemic is a growing plague that America is facing, with 115 people dying daily from overdose. We hope the information we provided will bring awareness to all health professions. In regards to oral health, it is always important to maintain good oral hygiene and visit your dentist routinely, especially when you have high risk factors such as opioid addiction.